Hello, I'm Blair Richey, Iredell County Emergency Medical Services Director. Iredell County Emergency Medical Services, with the support of our county commissioners, has quickly adapted to the latest guidance and updates and developments in regards to COVID-19 starting in January of this year. Iredell EMS developed a screening tool in January to be used by our communications department, as approved by Dr. Brian Beaver, our medical director, making us one of the first counties in the state to implement this practice. This screening tool was developed to help identify the population at risk so the EMS could respond with appropriate equipment and measures in place to provide care and limit further exposure to others. We continue to work closely with our medical director, Dr. Beaver, the North Carolina Office of Emergency Medical Services, Iredell County Health Department, and Iredell County Emergency Management, to name a few of the agencies, in order to immediately adopt all of the latest guidance received from the state and the CDC. Preparing so early has allowed for all the EMS staff to have training conducted by Dr. Beaver himself, with continuous on-duty shift training to quickly adapt to all the new guidance. Our paramedics feel confident in their abilities to respond and provide emergency medical care as instructed by our protocols that were developed in response to COVID-19. All of these protocols are shared with our first responders within our fire departments and rescue squads as part of the team of public safety in Iredell County. In following the guidelines from the CDC, the North Carolina Office of EMS, Iredell EMS will continue to adopt the latest guidance to limit exposure further to our community. The guidance will include a change in response, but this response will mirror our fellow counties as well as the nation as we all continue to work together to protect the public. We review guidance on a daily basis so that we are able to adopt new directives as quickly as possible. Iredell EMS's quick response has allowed us to plan for future scenarios before their potential arrival. We begin each day with health screenings for all of our staff to ensure our paramedics are healthy and able to provide care for citizens that are in need. We keep a daily total of our PPE and feel that we have adequate equipment at this time. We are fortunate in Iredell County to have strong relationships developed a long time before COVID-19 that allow us to serve the citizens in Iredell County in a joint response with all the entities represented. We want to thank our citizens for working with us to further limit exposure. We encourage you all to reach out to your primary care physician via the telephone if you feel you are developing symptoms of illness. Please continue to only call 911 with emergent needs. This further allows us to focus our efforts to respond appropriately and timely in critical emergencies. Iredell EMS will continue to work on creating responses that help to mitigate this crisis and maintain adequate response levels. Again, we ask, unless it's a true emergency, please reach out to your doctor to seek medical care and instruction before calling 911.